Hello everyone. Today, me and my colleagues, we are going to present to you this case. General data: a 45 years old female patient came for routine dental checkup. Chief complaint: not mentioned. History of present illness: patient doesn't have any chief complaint since no history of present illness. Past medical history: she was diagnosed with coronary artery disease and is on aspirin therapy since 2 years ago. Past dental history: patient gave history of extraction of her upper right third molar before 10 years ago. Family history not mentioned. Habit history and clinical examination also not mentioned.
Radiographic interpretation: regarding the OPG, an overall look showed multiple small radio-opaque lesions, round shape, located in angle of mandible, posterior border of the ramus and inferior to external auditory meatus. Measurement approximately 1 mm in 1 mm in size. It could be microlithiasis in parotid sialadenitis. This should be taken into consideration for further investigation. OPG and PA radiograph shows radioopacity solitary oval-shaped lesion located in the upper right posterior region in maxillary arch, measuring approximately 10 mm and 7 mm in size. No effect on surrounding structure was noted.
Periphery: it's well defined and the borders are slightly irregular with sclerotic margin. The internal structure is radiopaque.
Radiographic differential diagnosis. First differential diagnosis is fragment of remaining growth. Clinical features: asymptomatic condition usually observed on routine radiographs examination. Radiographic features: localized radiopaque lesion surrounding by well-defined radiolucent margin, size 7 to 10 mm. Histological features: there was a position of laminated acellular cementum along dentinal walls, produced by cementoblast arising from undifferentiated mesenchymal cells in the pulp. Fractured surface of the fragment appeared to be undergone constant resorption and repair, with the net result of acellular cementum replacing fractured dentin. Second differential diagnosis: idiopathic osteosclerosis. Clinical features: asymptomatic condition usually observed on routine radiographs examination. Radiographic features: localized radiopaque lesion, well-defined bony radiopaque, round mass, size 2 to 3 mm to 1 to 2 cm, composed of dense calcified tissue.
Third differential diagnosis: focal cemento-osseous dysplasia. It's a symptomatic condition usually observed on routine radiographic examination. Well-defined 2 cm in diameter sclerotic masses. Histologically, replacement of normal bone by fibrous tissue and subsequently followed by its calcification with osseous and cementum-like material. Fourth differential diagnosis: bone exostosis. It's asymptomatic unless the overlying mucosa become ulcerated from trauma and usually bilateral. It's radiopaque lesion, well-defined, round calcified structure less than 2 cm in diameter and can go bigger than with the time. Histologically, microscopic examination show a masses of dense lamellar cortical bone. An inner zone of a trabecular bone sometimes is seen.
Histopathological investigation: the lesion is asymptomatic, and based on history, clinical features, and radiographic findings, no histopathological investigation is needed. Excisional biopsy is warranted if there are symptoms or any significant radiographic changes. As we reach the definitive diagnosis, Our definitive diagnosis for this case is a fragment of a remaining root. The management of this case: patients with asymptomatic remaining root fragment indicates no treatment and should be left as it is with periodic radiographs and follow-up, especially the patient is using aspirin due to her coronary artery disease and if there is little or no tendency of the lesion to progress or change.